Hello, my name is Alexi Wilson, and I am doing my policy analysis on substance abuse within families. Uh, this is my table of contents and discussing what I will be going over during my PowerPoint presentation. First, I want to identify the problem, and substance abuse plagues many individuals all around the United States. Additionally, many of these individuals have children who are affected the most because of their parents' substance abuse. 38.9% of children who are removed from their homes is because their parents are abusing substances or alcohol. 12% of children who are currently living in the household were at where at least one parent is abusing or dependent on substances. Scope of family suffering from substance abuse. Parents with a diagnosed substance abuse disorder are more likely to physically abuse, commit child neglect, or have a higher chance of abusing their children than those who have not been diagnosed. Also, families dealing with addiction have a higher risk of poor performance in school, and behavioral problems, low self esteem, a higher risk of physical, verbal, or sexual abuse, and an early onset of experimentation with drugs and alcohol. Identify the desired outcomes. Children who are in families who are facing addiction need interventions that will help them progress. Substance use disorder is powerful and destructive, but it does not have to be the end of the story. As far as desired outcomes, I believe that rehab is a great tool for clients, and it is also the first step in receiving help. The clients need more motivation to stop and seek sobriety, and rehabs provide that to them. Suboxone is a medication used in treating those addicted to opioids, but also helps individuals dealing with substance abuse of various drugs. Substance abuse programs for families. I believe these programs should be catered towards everyone in the family and also provide mental health counseling for every individual in the family. I must also identify the barriers of accomplishing the outcomes, and as even though rehab is a great tool for and a first step for the clients um, who are needing help with suffering from addiction. According to American Family Addiction Specialists, 40 to 60% of individuals relapse within 30 days of leaving the inpatient drug and alcohol treatment center. Also, it is important to note that Suboxone, although it is a drug that is supposed to help with addiction, the drug is also given to individuals who are recovering from substance abuse withdrawal, but sometimes it defeats the purpose because they become addicted to the Suboxone. Also, women who are taking Suboxone while pregnant sometimes become addicted to the medication, and this is not good because even after the pregnancy, women still crave the Suboxone and use it as another form of addiction. It is important to identify the target for advocacy, and I believe that the important target is the healthcare system. There are various individuals who have been prescribed painkillers such as opioids as a way to help relieve their pains. However, this medication becomes more addictive and some individuals resort to cheaper ways of abusing substances, and this gives them the same feeling that they did while taking substance abuse with while taking this medication, and they believe that it is a better there needs to be a better, less addicting alternative for individuals who are suffering with substance abuse, and also there needs to be more treatment plans for these individuals other than just giving them medications. There also needs to be um, counseling and interventions for them. Um, to determine who has the authority to eliminate the barriers, healthcare policies and legislators who are in charge of creating these policies. Many individuals who want to seek treatment for their addiction cannot afford treatment. Moreover, various individuals who do not have access to affordable health care and the ones that do have access find themselves not being able to pay for treatment. There needs to be a reform in these healthcare policies so that every individual can afford proper treatment and not just given medication to stop their addiction, but actually receive treatment for their addiction. I also have a picture here, and in the picture you can this is the individual treatment option estimates for individuals who are wanting to seek treatment. And if you look here where it says inpatient care, it is $500 to $650 per day for individuals who don't have insurance, which is very expensive, especially for these individuals who can't afford insurance, let alone afford treatment plans. So they just stick to what they know, and they will continue to use these substances. Also, if you look here, it costs 2,500 plus other expenditures for sober living homes and halfway homes. So these individuals are almost being prosecuted for their substance abuse, and when they want to get help, it's like they are having to pay all this money and they can't afford it, and it becomes stressful for them, so they continue to revert back to what they know, which is their addiction. Identify other organizations and or individuals who are interested in the issue and share your concerns. There are multiple organizations that are trying to help with individuals who need substance abuse treatment. These are just a few of the ones that I wanted to highlight. One being the Substance Abuse and Mental Health Service Administration, also known as the SAMHSA. This organization offers services for individuals and family members facing mental and substance use disorder and provides referrals to local treatment facilities, support groups, and community based organizations. Next, you have the Recovery Village, which provides help to individuals seeking help for their loved ones who are facing addiction. Moreover, they provide critical support in several other organizations that help families and addictions. Also, I wanted to highlight a local organization, the Alabama Department of Mental Health. They have a substance abuse treatment service that is community and outpatient based and is a residential service for individual and family treatment. Discuss strategies for changing the situation. Um, First, I would like to publicize the problem and possibly embarrass the target. The target is the healthcare system because it is failing individuals at a magnitude that I can't even describe, because it is this although this is probably the most aggressive option when it comes to facing this issue and tackling the target head on, but it also can be the most effective because in the many years that have been there, it has been almost proven that when an issue is brought into the forefront and other people from like when social media or something happens and it goes on social media, it blows up to where it makes people aware of what's going on. So that's what needs to happen with this healthcare system, because there are individuals who are unaware of what is going on with the healthcare system. As long as they're getting their benefits, they are almost blindsided to what is going on the other side, and the healthcare system is extremely flawed. It needs to be renovated and allow all individuals to have proper access to treatment, because because they are being subject to addictive behaviors because of the medications that the healthcare facilities are prescribing them, instead of there being healthcare facilities that are willing to help and not make the individuals pay so much money to where they can't afford help. Also, I would also organize a petition for others, because as I mentioned, I only mentioned 3 organizations in this slideshow, but there are multiple organizations that are trying to fight for substance abuse within families. And these organizations are advocating for individuals who are dealing with substance abuse and are working to keep families together to help them form a better knowledge about how healthcare agencies are not working for them, and also provide them with proper knowledge when it comes to their treatment. By organizing this petition, I believe that it will give individuals a chance to stand by something important, and they will begin to see the magnitude of how many people this is affecting, and maybe there can be finally be a change and a reform to these policies that are not helping these individuals. Lastly, I want to discuss tactics of choice and reasons for my selection. I believe that there needs to be an improvement of affordable healthcare intervention plans for individuals who are dealing with substance abuse, and that should start with reforming certain healthcare facilities to educate them on better alternatives for these individuals. I also believe that every facility should have a structural changes to the healthcare system, which means that every facility should have specific healthcare facilities for individuals dealing with substance abuse. I plan on advocating for families who have loved ones dealing with addiction. Moreover, for the children who are watching their parents struggle with addiction and are being removed from their homes. There are individuals who are suffering from addiction and need someone to properly advocate for their recovery. Moreover, they need help making that first step, and the healthcare system, I believe, is not handling these individuals properly. Additionally, these corporations are enabling the addictive behaviors by prescribing another addictive medication, but at the same time, that medication does help individuals get who are struggling with substance abuse, but it also can backfire on other individuals who are using it as another form of drug. So I just believe that there should be another form for these individuals to get help other than giving them another drug for them to get addicted to. My last slide is just my references for the paper. I'm sorry, for the PowerPoint. And thank you so much for joining in on my policy analysis PowerPoint. And you have a lovely day.